Joining me now is Independent Senator Bernie Sanders of the great state of Vermont. Senator Sanders, always good to see you. Thanks for joining us. Let's just plunge right into health care. President Trump threatening on Twitter both lawmakers and insurance companies on Saturday, saying he's prepared to cut off the, quote, bailouts that you and the insurance companies receive. What do you make of these threats?
You know, I really think it's incomprehensible that we have a president of the United States who wants to sabotage health care in America, make life more difficult for millions of people who are struggling now to get the health insurance they need and to pay for that health insurance. Maybe the president should put down his, stop his tweeting for a while and understand that America today is the only country, only major country on earth not to guarantee health care to all people, and the solution is not to throw tens of millions of people off of health insurance that they currently have.
What do you make of the threats directly at members of Congress about your health insurance? Mick Mulvaney was on the show earlier trying to explain what the threat exactly meant.
Well, I would turn that around a little bit and say to the President of the United States that, yes, every single American in every state in this country should be able to get the health care that members of Congress have. And that is why, if we are able to return to regular order, if we are able to have a serious debate on the health care crisis, I think there should be a public option available in every state in this country. If people don't like the private insurance that they're getting, if it's too expensive, they should have a Medicare-type public option available in every state in this country. And that's one of the ways forward.
When you were on the program on July 2nd, you told me you were going to introduce a single-payer health care plan literally as soon as we're through with the Republican health care debate. It seems like we're through, and the Obamacare repeal effort has collapsed. Are you going to introduce single-payer?
Absolutely. Of course we are. We're just, we're tweaking the final points of the bill, and we're figuring out how we can mount a national campaign to bring people together. Here's where we are, Jake, and it's important for Americans to understand this. We are the only major country on earth, the only one, not to guarantee health care to all people. The result is 28 million people who are uninsured, millions of people who are paying deductibles and co-payments that are far too high. And if the Republicans had gotten their way, there would have been another 30 or 32 million people thrown off of health insurance. That is crazy. What we should do is move in the direction of every other major country, guarantee health care to all people as a right, not a privilege. Second thing you got to do is ask ourselves a very simple question, which my Republican friends and the president does not. Why is it that in America, per capita, we are spending far, far more on health care than do the people of any other country? Why are we paying by far the highest prices in the world for prescription drugs compared to people all over the world? Those are the issues we've got to tackle. And I think the answer is pretty obvious. What we have now is a health care system not designed to guarantee health care to all of our people in a cost-effective way. What we have is a dysfunctional, complicated health care system designed to make as much profit as possible for insurance companies and drug companies. And you have an incredible bureau. Go ahead.
I want to get into single payer. Just the quick note: the 32 million figure that the senator is referring to is from a Congressional Budget Office study of what happens if there was full repeal of Obamacare with no replacement. Some of those, of course, are people voluntarily getting off health care because there's no more punishment. But let's talk about single payer, because it was attempted in your home state of Vermont, and it didn't work because they couldn't get the funding because it would be too expensive, the Democratic governor said. And then recently it failed in California as well. Democrats, again, not able to come up with a way to pay for it. These are cobalt blue states, Vermont and California, where people wanted single payer, and there were problems because it would cost too much. How do you make it national if you can't even get it in Vermont or California?
It's not no. Jake, let's be careful about this.
All right.
A single-payer health care system, in my view, and according to studies that I have seen, would save the average family significant sums of money. And what Republicans sometimes do is confuse the issue. And they say, well, you're going to pay more in taxes. What they forget to tell you is that if you are a family of four, now paying $15,000 or $20,000 a year in private health insurance, you're not going to be paying that at all. Once again, if you look at Canada's single-payer healthcare system, per capita, their costs are far, far less than the United States. if you look at the UK, if you look at countries around the world, all of which have different approaches to a national healthcare system, in every instance, they are spending substantially less per capita than we spend in the United States, substantially less for prescription drugs. The problem with our system is it is so complicated for the consumer, for the doctors, is that a hospital, for example, might be dealing with 15, 20, 30 different insurance policies. It takes an enormous amount of time, energy, and expense to figure out that you have a $5,000 deductible, you have a $10,000 deductible. The goal simply is to say that every person in this country, through a single-payer system, is entitled to a comprehensive health care approach, and that will save substantial sums of money in administrative costs, substantial sums of money in lower prescription drug costs, substantial sums of money in doing away with the profiteering of the drug companies. By the way, the 5 top drug companies in 2015 made $50 billion in profit. These CEOs in the healthcare industry make enormous salaries.
Right.
We should join the rest of the world, begin that discussion immediately, and I will be introducing legislation to do just that.
Well, why couldn't this happen in Vermont then? I mean, what's the issue in Vermont? Vermont would be would seem to be a perfect test case.
Well, politically, this is difficult. And by the way, in California, the debate is not over. It passed, I think, the Senate. It's now gone to the House, and that debate will continue. Look, taking on the insurance companies and the drug companies, taking on Wall Street, taking on a lot of very powerful forces that make billions of dollars a year from the current healthcare system is not going to be easy. And it's not going to take place until millions of people get involved in this struggle and appreciate the fact that whether you're rich or whether you're poor, healthcare is a right. The idea that the Republicans wanted to throw 32 million people off of health insurance, cut Medicaid by $800 billion, raise premiums for older workers, defund Planned Parenthood, make it almost impossible for people to have who have pre-existing conditions get the health care they need, that is abominable. That is moving in exactly the wrong direction. So we need a serious discussion about a serious issue, and I believe at the end of the day, the American people will conclude that Medicare for all, Medicare is working now for people 65 or older. Let's expand it to everyone.
Well, you were asked recently about the possibility of running for president again in 2020. You said, quote, "I am not taking it off the table." On August 31st, you're going to be back in Iowa, specifically in Iowa City, to promote your new book, Bernie Sanders' Guide to Political Revolution. Are you testing the waters for 2020? Is this still possible that you're going to run for president again?
I know, hard to believe, Jake. You know, Jake, one of the things that I always get a kick out of is that in Canada, they have elections, I think it's 2-month period. The UK, it's even shorter than that. In the United States, we have never-ending elections. Right now, as the United States Senator from the state of Vermont, I am dealing with enormous issues. It's not just health care. It's trying to create an economy that works for all Americans and not just the 1%. It's developing a tax system that does not give huge tax breaks to the wealthiest people in this country. It's rebuilding our crumbling infrastructure. It's dealing with climate change, transforming our energy system. Those are the issues that I and other members of Congress should be dealing with right now. We got 3 years before the presidential election. We got plenty of time for candidates or potential candidates to make decisions.
I'm going to take that as a yes, it's still on the table. Senator Bernie Sanders, appreciate it. Thank you so much for your time.
Thank you very much.